Thank you, Chair Murray, and to the witnesses. Dr. Fauci, can you provide us a general breakdown of what percentage of hospitalized individuals are vaccinated versus unvaccinated, and what percentage of COVID deaths are among vaccinated or unvaccinated individuals?
Thank you for that question, Senator Kaine. One of the ways to answer that question would be to look at people who are in the hospital and take a look at if you are vaccinated versus unvaccinated. And if you look at vaccinated versus unvaccinated, there's about a 10 times greater chance that you'd be infected if you were unvaccinated, about a 17 times greater chance that you'd be hospitalized if you were unvaccinated, and about a 20 times likelihood that you would be dead if you were unvaccinated. So when you look at every parameter, 10 times, 17 times, 20 times, infection, hospitalization, death.
Thank you, Dr. Fauci. Ms. O'Connell, I want to ask you a question about additional vaccine development. The current vaccines against COVID, as was indicated by Dr. Fauci's answer, have been very successful in reducing deaths, severity of illnesses, and hospital admissions. However, they've had more limited success in preventing forward transmission from vaccinated individuals after breakthrough cases, and the existing vaccines are not as durable as vaccines in other areas, so we need booster shots to continue to protect against the virus. Is the administration considering supporting the development of additional vaccines that might be able to address the gaps in the current vaccine's capabilities?
Senator Kaine, thank you so much for that question. Yes, absolutely. I think we all see the need for next-generation vaccines. We are also looking for next-generation antivirals and therapeutics as well. We're in the process of working with Dr. Fauci's team to develop a unified NIH BARDA research agenda and budget to address these issues, to identify candidates that might already be in the pipeline, to help support the research into candidates that are just starting in the pipeline, so we can accelerate the availability of next-generation vaccines and therapeutics.
Thank you for that. I'd like to ask you a question about access to testing, and in particular, what is the CDC doing to make sure that testing capacity is robust in rural America and also among community health centers in disadvantaged parts of the country?
Thank you, Senator Kaine. So we have this program, Increased Community Access to Testing, in collaboration with ASPR as well. This is a program that has collaborated with FEMA to increase surge testing just over the holidays. We've increased federal testing sites for PCRs, 12 federal testing sites doing thousands of tests over the holiday. We also work with pharmacies. This is a collaboration with pharmacies. And in that stead, we are able to map where the pharmacies are and their social vulnerability index, and we can actually put PCR tests in areas of high social vulnerability index through all of our pharmacy partners, CVS, Walgreens, Rite Aid, and whatnot. And then we actually put tests in our community centers as well. So really a broad stretch in order to be able to get access to testing, especially among those most vulnerable. And then, of course, as Asper O'Connell mentioned, $10 billion for testing supplies to our schools, and working closely with our schools in peer-to-peer support, in technical support to allow those tests to be used well in those school settings. Thank you.
Thank you for that answer. And Dr. Fauci, one more question for you. I ask a version of this question every time we have this panel before us. What is the NIH doing right now, or what's the current status of NIH research to better understand long COVID, to look at symptoms and potential treatments?
There are several levels of activity going on. Some news since we spoke last. I had mentioned to you, Senator, that in fact there was a $1.15 billion program for studying long COVID that is now developing cohorts to look at various incidences, prevalences, pathogenesis, and potential interventions. There have been a number of awards that have been given. Most recently in September, there was an additional $470 million funding supported through the American Rescue Plan, engaging about 100 researchers from 30 institutions to get individuals together. One of the things that's really interesting that we're seeing right now is that when you look at individuals who have these symptoms that go on, as you know, and have experienced yourself for a considerable period of time, a recent study that is in the preprint stage, so it hasn't been peer-reviewed, has some very interesting information that needs to be validated and verified. It was an autopsy study in people who had varying levels of COVID, from relatively mildly symptomatic to moderately symptomatic to individuals who actually died. And when they looked at the spread of what was not necessarily replication-competent virus, but was PCR-able virus, which means you could have nucleotides that were there seems to be a persistence in multiple organ systems, indicating that even if you clear the virus, one of the possibilities, and I have to emphasize possibility because it needs to be validated, is that you don't completely clear the fragments of the virus and you have continual stimulation, not that you're infectious or that you're going to infect anybody else, but that it is still generating perhaps an aberrant response in your immune system. I underscore again, it's preliminary, it's in the preprint stage, and it needs to be peer-reviewed. But that's some of the information we're starting to gather.
Thank you very much for that answer. Thank you, Chair Murray.
Senator Paul.
Dr. Fauci, the idea that a government official like yourself would claim unilaterally